crush the root of this small shrub and it smells, unmistakably, like a sweaty horse. That smell gave ashwagandha its name. For more than 2,000 years, Ayurvedic practitioners used the root in preparations for strength, sleep, and recovery. Today it appears in premium bottles approaching $40. The trial results are intriguing, the safety file is harder to ignore, and those warnings are easy to miss in the marketing. We'll trace the root from Sanskrit medicine to modern extracts. Put the positive stress trials beside the trial that did not beat placebo, and name the group's official guidance says should avoid it, or ask a doctor or pharmacist first. It grows as a modest grey-green shrub across a broad Old World range, from southern Europe and Africa through western and southern Asia. India became its great centre of cultivation and use. Botanically, it belongs to the nightshade family, alongside tomatoes and belladonna. That family fact does not prove that their risks are the same. Ashwagandha has to answer for its own safety record. The root appears in Sanskrit medical texts more than 2,000 years old, the Churaka Samhita, the Sushruta Samhita. And there it sits in the most prized class of all, the Rasayana. The rejuvenators, herbs meant to restore vitality and slow the body's wear. Its botanical name carries a second promise the physicians noticed too: somnifera, sleep-bringing. A root, they said, that could make you both stronger and calmer. Traditional preparations folded the powder into warm milk, simmered the root in water, or worked it into medicated ghee. In Ayurvedic terms, ashwagandha was used to calm an excess of vata, the principle of movement, of a racing, depleted, anxious body, and to build ojas, the deep reserve of vitality. Practitioners have traditionally reached for it for exhaustion, for restless sleep, for weakness after illness, for the fog of chronic stress, and as an aphrodisiac and strength tonic. The Indian ginseng. It rarely travelled alone. It was powdered into churna and stirred into milk, simmered into a medicated ghee, and fermented into ashwagandha rishta, a fermented Ayurvedic preparation. Traditional practitioners described the same aim across those forms: restore strength and calm after strain. The premium bottle came much later. So did the premium price tag now attached to it. For most of that history, this was tradition, a promise passed down. Then, in the last 2 decades, laboratories ran the trials. Several moved stress scores or cortisol. One later trial did not beat placebo. That split is the story. Stress scores, cortisol, and sleep are the best studied human outcomes. Several small, short randomized trials reported lower perceived stress, anxiety scores, cortisol, or better sleep with particular extracts. But the products were not interchangeable, and a 12-week trial in stressed adults found no significant stress advantage over placebo. NIH lands in the middle. Some preparations may help stress, anxiety, or sleep, while the trials do not identify one product, dose, or regimen. Those mixed results do not settle every bottle. Now the root has split into 2 lives. In India, it remains a classical Ayush medicine, used in clinics and sold widely as churna and urishta. Everywhere else, the US, Britain, Australia, across the Asia-Pacific supplement aisle, it's been repackaged as a standardized adaptogen, a capsule sold to blunt stress, with branded extracts like KSM-66 and Sensoril. It's marketed for burnout, a modern word those old texts never used. Now the cautions that belong beside the marketing. Safety data in pregnancy are inadequate. NCCIH advises avoiding ashwagandha during pregnancy and not using it while breastfeeding. Published reports have linked ashwagandha products to very rare liver injury since 2017. Many people improved after stopping. Severe liver failure, transplant, and deaths in people with acute on-chronic liver failure have also been reported. Existing liver disease is an avoid-use group. Ashwagandha may alter thyroid function, and NCCIH does not recommend it for thyroid or autoimmune disorders. It can also interact with thyroid medicines, immunosuppressants, sedatives, anticonvulsants, diabetes medicines, and blood pressure medicines. Guidance also warns people preparing for surgery and men with hormone-sensitive prostate cancer. The law reflects that uncertainty. In the US, it is marketed in dietary supplements without FDA pre-approval for safety or effectiveness. The UK allows it in food supplements while its safety review continues, and the FSA says no safe level has been established. Australia permits it as an ingredient in listed medicines. Canada authorizes specific natural health products carrying an NPN. Denmark took the hardest line. After a 2020 DTU risk assessment, it prohibited sale as food in 2023. Where you live changes what can be sold. Status checked in 2026. Ashwagandha is an old, strange root with some positive short-term stress and sleep results, and a safety checklist much longer than the marketing suggests. Avoid it during pregnancy or breastfeeding and with existing liver disease. If a thyroid, autoimmune, or hormone-sensitive prostate condition applies, or if medicines or surgery are involved, bring the exact product to a doctor or pharmacist before using it. Long-term safety remains unknown. So what about dose and timing? The useful answer is that the trials do not establish one. They tested different plant parts, extracts, schedules, and durations. A result from one product cannot be copied onto another. Warm milk and ghee belong to the traditional story, but human evidence has not shown that milk, fat, or piperine improves ashwagandha absorption. There is no proven best hour or universal home recipe. Check the exact product and your medicines with a doctor or pharmacist before deciding whether it belongs in your routine. Ashwagandha is a horse-smelling root with 2,000 years of history and premium bottles approaching $40. Neither age nor price settles the question. A result belongs to the exact extract tested. A warning belongs on every bottle. Next, we cross to China for a route once reserved for emperors. Follow for its history, its trials, and the risks the label leaves out.